Okay, hello everybody. Thank you for coming, and thank you to both of you for being here. I think let's get straight into it because we're starting a bit late. So starting off, we're going to talk about AI and the potential for AI in healthcare and also the risks, right? But let's start off with AI, and it's very hyped at the moment, right? Everywhere you go, people are talking about AI in healthcare and across the board. Is it worth the hype? And can you give me an example from your experience of why you think that? I don't mind who starts.
All right, thank you so very much, and good afternoon, everybody. Let me answer categorically that yes, it's worth the hype. Now, I am not an expert. Let me issue this disclaimer in AI. I'm just somebody who happens to use it and love it. This whole thing started 70 years ago, 1956, when it was introduced. It went through what they call the AI winter when it comes to financing. It gets up and gets down. But just like everything that happens in life, it starts people kind of not having so much belief in it. Just like when the computers came, we were like, no. But now who can live without a computer here? Almost nobody. And same is going to happen with AI. And whether we like it or not, it's already being introduced. It's only going to get better because it's getting more financing, and the younger generation, they like it more, and very little can we do to detain it. Now, in my personal experience, I'll tell you a short story. In 2001, Ghana had the first Siamese twins joined in the head, and I led that surgical separation of the twins. I got introduced to AI with the use of Oculus for surgery. So I could be home, just put on my Oculus, and virtual reality and augmented reality. And I have a surgeon in India, I have a surgeon in UK. We get in there. All we had to do is to do the CT scan, the MRI, segment them, put them in the visual reality, and we are in the theater. We had a chance to practice that surgery over 100 times before we step in. And since, I've been using it throughout my practice. And what it does is, when I go into theater now, I can even close my eyes because I know exactly where I am because I've been there 100 times, and it's so good. It helps you to navigate. Then I became the Director General, and I had a call about AI and X-rays for TB. And guess what? In a country of 33 million citizens, we have less than 100 radiologists. And I'm talking about looking at the health of Ghana, where I'm thinking of free primary health care for everyone and quality health care, just not health care, quality health care. And with AI machine for X-rays, this is what happens. We're able to deploy the sample to the most remotest corner you can find in Ghana, and they get the X-ray done, and they get the result immediately. What is better than this? So practically, it's something that we must welcome, whether we like it or not. The next generation has already welcomed it, and it will only get better. We'll come to some of the disadvantages. I will not talk of that now, but I'll limit to your two questions. When the height, yes. Example given. Thank you.
Thank you, and to you as well.
Good afternoon, all. So for me, I think AI has come to stay. It's an indispensable tool. Why do I think that we need it? How important is it? It's very simple. It makes my work very easy. It enables me to make informed decisions. So I used to remember when we operate some dashboard that are not AI enabled, and then I will be standing there. I say, click on this variable, move it to this one. Click on the other one, move it there. Or I click this one to show you the graph, and so on and so forth. You waste a lot of time, and you are not so sure. But now, because all of us are using AI, of course, which I use it now. In Nigeria, I'm Director of Public Health, and Nigeria is over 260 million people. I have over 15 divisions. I have more than 3,000 staff. So I don't think there's any margin for error or any analog you may want to be dealing with. So I simply will look at what is happening. We are planning to do an investment in tuberculosis. Can you tell me, given all the variables that you have, if I put another additional $500,000, what will happen? It will simply give me a projection. If you do so, it will help you to do this one. But if you do it the other way, this is the most likely outcome that is going to come out from it. So it makes it very easy. So I take it and I call the TV program and I say, okay, so where are we going? Where are we? See the projections we are getting. And most of the time, within some margin of error, it is depending on the garbage in. Because don't forget that all these electronic platforms are garbage in, garbage out. It depends on the information you have fed into it. So we make sure that the data we put in there is very validated. So for me, AI is an indispensable tool. And I think it has come to stay. And I think that going forward, anybody thinking we will still go back to the way we used to do things before, I'm sorry, that's not going to happen again. Thank you.
Great, thank you. And then I guess the sort of flip side to that is, what are the potential risks or challenges of using AI? And, there's lots of things around, is the regulation keeping up? Are there any problems with, hallucinations or a digital divide where some people can use AI and some people can't? Like, what are some of the biggest risks or challenges that you face? And let's start with you, as you've got the mic in your hand.
So, I don't know whether to call it risk. It's just like when we started with telephone in Nigeria, GSM. People were talking about the risk. But usually, as a medical practitioner, we are taught to always weigh the pros and the cons. So once the benefit outweighs the risk, most times it's not anything. I know people used to bother about with AI, there will be job losses. Many people are not literate enough to use it. But I think it will still get to like the way we use phone. My mother was not educated, but at a certain point in time, if you give her a telephone, she can make a call. You say hello, she will use it, she will call, even though she may not be able to type because she was not literate enough as at that time. May her soul rest in peace, So the potential risk there, if you ask me, I just think this is just part of the initial drawback. When all of us get started, we will know that those things are not like the job loss, like many people cannot use it. So people will say, okay, if you put this, who can use it? But I'm sure that going forward, by the time, even if it is included in school children's curriculum, and the time, just give it another 5-10 years, it will just be like telephone where everybody can begin to use it. So that's the way I look at it. For me, there are no potential risk. Job loss, okay. But somehow we must move on.
Okay, and Dr. Kaba?
All right, let's get this straight. You got to look at the definition. What are we talking about? And it's about the human being using the computer and training it to do what the human would have done, but would do it better than you and faster than you. As I said, I'm not an expert, but I've been going through this. This is the risk. Those who do AI for long and the pioneers, they've already envisaged or envisioned that in the near future, there is some part of AI that you train the computer, it gets to some point, it starts to do what you cannot regulate anymore. And so some of them are reserved because of that. But then comes the next point. That is, everything that a human does comes with rules and regulations. It has its ethical points. So it depends on we, the humans, who control the computer, how far do we want to get, and what are some of the regulations and rules we put in place and ethical points we put in place that can regulate how far we can go. But yes, if you look at the benefits and these restrictions we're talking of, then the benefit outweighs the possibility of giving a lot of restrictions. I'll give you an example. 110 years ago, when they looked at the human brain, we only had about 52 areas of that we could say eloquent. Places that when you touch in the brain, you might have some kind of deficit or defect in you. Today, with a computer system, with what we call human connectomies, they've been able to define over 108 places which are eloquent. It helps us to do better surgery. It helps us to do more precision surgery. It helps us to give quality of health. If I should ask everybody in the room to close your eyes a minute and imagine in that village where you have a lady pregnant and you give a machine a test and it says that translate that test into the person's language and tells that pregnant lady that your pregnancy has A, B, and C. If you don't go to the hospital early, you will die. And it translates in the language of the person, and the husband is also right there. What do you think they will do? They will immediately go to the hospital. That is more than what we could have done. And how many people can the AI do for? Many. How many can we human do? Very few, because it takes the doctor to work there. And if you have, as I say, 250 or plus million people, if you have more than 33 million people, and you have one doctor to over 10,000, over 20,000, over 100,000, then you cannot do it by yourself. So we have to outweigh the risks and get this done and look at it from this perspective. Regulations, and then those who work on it will determine where we go into. But for sure, and to my colleagues from the developing countries, sorry, sometimes I talk of these things a little bit faster because if you look at the shape and evolution of the world, you have the agricultural era, the industrial era, technology, now robotic, right? We, in the developing countries, we are not in the robotic era. We are still trying to industrialize. How do you get there when you have a lot of regulations that tells you that you cannot do this, you need to have green machines, green this, when they did not start with green machines? The only way you can do is to also move into AI-powered agricultural system. Because health should not be seen as just the human being and sickness. You have to look at the environment. What you eat counts, your environment counts, the plants, the animals, everything. So you have to look at what AI does for you in each of these sectors. And you find out that the only way to catch up is to embrace AI as quickly as possible and be able to also advance as quickly as possible, or else we're going nowhere. Thank you.
No, thank you. And then I guess, you talked about AI doing things better and faster than humans. And I think there is a real fear, not just in healthcare, but, across the board about where AI might replace humans. And what I wanted to ask you is, what do you think, human medics, healthcare workers, nurses, what do they bring or what can they bring in a world where AI might help them do their jobs? What do you need from the people who are still in the system? Maybe we'll start with you. Yeah, what does the human bring that AI doesn't?
Well, what's the human brain that AI doesn't? Don't forget, I don't think anything will be can be bigger than a human brain, because it's the human brain that also builds AI. So everything that man has produced is subject, to what man can do. Because even the AI, even human, just like when you finish doing things, even hackers can hack into it. Even the AI, people can even corrupt it, and it will give you wrong information. So, but AI is a tool, just like I say, tool in the hand of human beings. So you can use it for good. You can also turn it if you want to use it the other way around. So that's what it does. But I want to just paint a scenario. When I took over as director of public health, I was opportune to speak with WHA, and they came to me. They say we are doing chest X-ray, one of the problems that we have from where we come from is problem of manpower, which AI is even helping us to fill the gap, And then, just like in Nigeria, we almost do 60 million people. The number of doctors there, of course, we are having a vertical migration. Most of them are in Europe here. So we have just few of them, and then the health workers. And then, one of the screening tests for tuberculosis is chest radiograph. It can help you. So when you use it, it can help you to segregate your candidates so that you don't carry all of them to GeneXpert because the cartridges for GeneXpert is very expensive. So when you do the chest radiograph, based on the indication, you can be able to say, okay, these people are qualified. And now I say, so how do you manage to do this large scale? They say, no, we have an AI component part of it. So instead of looking for people who will interpret it, of course we don't have. The only valid person that can sign the chest radiograph in Nigeria is a radiologist. So you have finished as a doctor, then you go and do additional training to become a consultant radiologist. So if we begin to look for all of them, then there will be a problem in the entire areas in Nigeria, where you go to a whole community of almost 2 million people that's even no doctor, or the next person there is a nurse, who is overseeing the place. So these are the capabilities of AI. So when they do those massive chest radiographs, they put it, whether it's CT scan or whatever, it can interpret it. And when it interprets it, it helps us to segregate the patients. And then those people that can go for a GeneXpert machine will go there. But there's another interesting thing in what they shared with me. Because in the bid to do that, we discovered that even the chest radiograph is beginning to talk about other non-communicable diseases. That's a different conversation. So I've asked them, I want to see it because we want to look at it and see the locations. And some of the things we are seeing is, and well, let me not talk about it because I have a preliminary result from them. So these are the kind of things that AI can help us to do, including even that manpower that are thinking about that AI will take away. AI is even helping us to complement, to augment that manpower we are talking about. Thank you.
Okay, brilliant. And just, I think we're quite near the end, so Dr. Kaba, just quickly, what do you need still from humans? What can humans bring to the healthcare system that AI can't?
This touch. The human feeling. No matter what, the human will always need to listen to that voice that is calming, and feel that the person also feels the same. Actually, AI is to complement our efforts to get early diagnosis, to perform early treatment, be able to do the necessary rehabilitation and all that is necessary. But it's technically, for now, I don't know into the future, but for now, it's to complement our efforts and make it even better and quality. And we can never substitute the human touch with AI. I do remember very well during the COVID, and we all remember, we're doing a lot of online meetings, Zoom, what do they call it, and all those online meetings. Today, it's still necessary. People still prefer to have that touch. You're doing a business, you can put two AI machines, negotiate among yourself. There will be no trust. But what the human being needs is that trust. And that trust from another human being. That cannot be substituted. Thank you.